Hey everybody, it's the Boss Lady here, coming to you with a different type of video. I have mentioned this particular topic in at least two of my videos, and so I want to go more in depth about it because I didn't in either video. And I want to talk about something that is a factor in Boss Lady's life, which is polycystic-ovarian syndrome. And most people call it PCOS. That's the quick word for it, if you want to call it that, or acronym. And so PCOS stands for, like I said, polycystic ovarian syndrome. I was diagnosed with it back in 2003, May of 2003. I had been having symptoms and issues with it prior to 2003 and was misdiagnosed. I was told that I had endometriosis and I had very horrible periods, just just excruciating pain, cramps and things. And then all of a sudden my periods kind of like disappeared out of nowhere, and we didn't know what was going on. And so I had went through a series of tests all throughout 2002, and I was having issues with birth control where the different birth control pills were not working for me. Normally, the normal birth control pills, you have, you take pills for 3 weeks and then you have a cycle on the 4th week. Well, my body was counteracting those pills, and so I would have a cycle, a period for 3 weeks, and then have no period for a week. So I was the opposite effect. I also tried the Depo shot and had a period for 6 months. So my hormones were definitely out of whack. I couldn't figure out what was going on, and so I had to go through a series of testing. I had to have pelvic ultrasounds. I have a file this thick full of pelvic ultrasounds showing the cysts on my ovaries, as well as I had to do blood tests and everything. And finally, the test results came back that yes, Boss Lady was polycystic. So let's kind of go over what does it all entail, what does it mean, and then I can give more of my story of what I dealt with. So polycystic ovarian syndrome is a problem with a woman's hormones, and I have my tablet right here just so I can read to you. And I'm actually on WebMD, and I will link WebMD's site in the description box below. It can cause your periods, cause problems with your periods and make it difficult to get pregnant, which, yes, that was an issue also for me. It also may cause unwanted changes in your life, in the way that you look. If it goes untreated, it can cause serious health problems like diabetes as well as heart disease. So that's kind of the gist of it. It's a hormone imbalance, and it can cause an array of things to go wrong with your body if you are not treated properly. So let's go on to the causes. So really, they don't know what the cause is for polycystic ovarian syndrome. They just know that it is a hormone imbalance. But they do believe that genetics is also a factor. So it's caused by hormone changes, and then the changes triggers another, which changes another. So that's pretty much the cause of it. Then we'll talk about symptoms here. So the symptoms can be an array of things. I know for myself, my first symptom was, just having difficult periods or obsolete periods where we didn't know why my periods weren't coming. And I could go anywhere from 30 days to 70 days without a period. And the symptoms normally kind of gradually start, so you don't know like right away what it is. For me, my first symptom was the periods changing. Then I also noticed like the excessive weight gain. For some people, it starts in their teens. For me, it did not. Mine started later in life. Well, later in my 20s. So normally it starts with, changes of your period and then also changes with your weight. Normally what happens with polycystic ovarian syndrome, I'm sorry here. I'm trying to read and scan and all this stuff. So, because I want to give you the correct information. But normally what happens, it can affect your reproductive system and how your body handles blood sugar. So that's another factor. And it also can affect your heart. And so, when I spoke in my Talk About It Tuesday about, weight and having high blood pressure, some people will contribute, oh, well, your weight is the reason why you have high blood pressure. Well, not only was my weight not the actual issue, it was stress-induced was the reason why I had high blood pressure, as well as family history, and then because of the polycystic too is the reason why I have high blood pressure. And I actually found that out just within the last less than a year, when I had the DVT, the deep vein thrombosis, which was blood clot in my leg. It was my specialist then who told me that's the reason for your high blood pressure is your polycystic. So yeah, there we go there. So reproductive problems. So hormone imbalances can cause several types of pregnancy problems, and one is definitely infertility. Another one is miscarriages, gestational diabetes, increased blood pressure. And I will say with both my girls, I did not have the increased blood pressure during pregnancy, nor did I have gestational diabetes, so that was a plus for Boss Lady, but those things can happen. Also, precancer of the uterine lining. This can happen when you don't have regular menstrual cycles. And then uterine cancer is another thing that can happen. What increases your risk of polycystic ovarian syndrome? Well, let's see here. There's a lot of things. But mainly, the main risk factor is a family history of it. And so I don't know my family history of the polycystic ovarian syndrome, but I can tell you the women in my family pretty much have hysterectomies young. I'm trying to think. I'm almost 40. I want to say my grandmother had her hysterectomy in her 30s. My mom had her hysterectomy in her 30s. And then my sister, she's in her 40s but had one. So I'm still kind of teeter-tottering with that. But from my understanding, their hysterectomies were not due to polycystic, but could possibly be. They had other contributing factors, the reason why they had hysterectomies, but still genetics plays a factor. So it says your chance of having it is higher if other women in your family have it or have irregular periods or diabetes. Now, I do have a family history of diabetes. My mom was diagnosed with type 2 diabetes in her later 30s, early 40s. She is now, as the doctors say, quote unquote, diabetes free, but still teeter-tottering. My grandmother also suffered from type 2 diabetes, and then at one point got flipped to type 1 because she had to do insulin. So diabetes is a factor in my family. I don't have it. And then it can be passed down from either mother's side or father's side. And so I'm trying to think here. I don't believe my birth father was diabetic. But I believe there is diabetes on that side of the family as well. So the odds are stacked against me when it comes to diabetes. But as of right now, Boss Lady is not diabetic. And so I'm going to stop right there because I just want to give you kind of the history or, you know, the clinical versions and the true factors of what it is, polycystic, and how it comes about and everything. So let me just kind of give you my story here. Like I said, I was diagnosed in May 2003. I was also told that I am insulin resistant. When I did Google that, because the doctor that I had was very nasty. She had no bedside manner. Basically, let me run it back. Let me tell you how it was told to me. I kept going to the doctor. Something's wrong. My periods aren't coming. What can I do? At that time, I was so young, I wasn't thinking about my weight. I mean, I knew I was gaining, but I didn't know that was an issue until after I was diagnosed. But basically what she did was she came in. She said, okay, so let's have a chat. And I was like, okay, what's going on? She said, well, you are polycystic. And I said, what's that? She said, well, you have polycystic-ovarian syndrome, and that is the reason why your periods are going up and down. You're not having cycles every single month. Your body does not cycle like a normal woman. Normal women have cycles every 28 days, and you're not one of them. And then I was told, be happy that you had a daughter young, because most people with polycystic ovarian syndrome don't have children at all. It normally starts in their teen years. And I said, okay, well, as most of you know, and to my newer viewers, I had a daughter at the age of 14. So she told me be happy that I did, because I wouldn't have any more babies. And so when she told me that, all I could hear was no more babies. At the time, I was dating Boss Man. We had been dating since 93. And so 10 years at that point. And I was devastated. All I could think was, this man has no birth children, and my desire in my heart was to give him a baby. And now I'm being told, at no fault of my own, that I cannot do that. So I was devastated. I went through depression. I went through just a state of shock, cried. And then, you know, as more people found out what was going on with me, basically, I was being told it was reasons of any actions that, you know, having a child out of wedlock and, you know, things of that nature. So God was condemning me. It was a bunch of stuff. As I stated, she also said that I was insulin resistant. So she never told me what that really was. So basically, I was under the impression I did have diabetes. And so I lived my life as a diabetic for probably about 2 years. You know, I even walked around with a medical bracelet saying, you know, not only did I have asthma, but I had diabetes. Well, come to find out, I didn't have diabetes. I am borderline, meaning that at any given moment I could tip the scale of being diabetic, but I was not diabetic. One medication that they gave me is called metformin, or another name for it is called glucophage. That is a medication from the pit of hell. I'm just going to be honest. It's normally given to diabetic patients. And they normally start you off with like 500 milligrams. And some doctors will say, okay, you need to take 1,500 to 2,000 milligrams a day. Some will say, okay, well, we're going to gradually get you up there. So when she first gave it to me, she gave it to me at 1,500 milligrams. That medication right there will give you what's called met gut. You have diarrhea from the start. You cannot eat any roughage, so any type of lettuce, any type of green foods. I have developed a vitamin K deficiency, and that I get from my father, but not knowing that I had that, I was sicker than a dog. When you take that medication, when you have to go to the bathroom, not to gross anyone out, but when you have to go, you have to go. There is no, oh, I'll just hold it. Oh, I'll just wait. You will seriously have an accident. And let me tell you, it came close, okay? So that medication is from the pit of hell, honestly. And if you can avoid it. Because I tried my best. So like I said, when she gave it to me at 1,500 milligrams. off the gate, you know. And then another medication I was given was called Provera, and that medication, it is, which how she explained to me, it's a pill form of a DNC. A DNC, I will, you know, put the definition across the video, but basically that's when they go in and scrape the uterus after women have like a miscarriage. They want to make sure everything is cleaned out of there. This pill pretty much does the same thing. So what they did was they gave it to me, and then within 10 days of me taking it, like I took it for 10 days, and then within like a couple of days after, within 10 days of me taking it, I would have what's called a massive clean out, massive period, to the point of wearing pretty much diapers. You had to wear the biggest pads around because, yeah, it was just that much. And I had to do that. At that time, I was doing it every 3 months because my cycle was not coming like normal. What I ended up doing, because I had just started at my company, I started my company in 2002, like November 2002. I was diagnosed May 2003, and the doctor I had, like I said, she was just rude. So what I did was, when open enrollment came about, I changed insurance and I changed doctors. And so in August 2004, which was, wow, 12 years ago. Anyway, I researched doctors at my clinic, and I picked up the doctor that I thought would listen to me. So I sat my gynecologist down and I said, look, before you touch me, before you say anything, I just want you to listen to me, and then let's go forward from there. So I sat down with him and I said, you know, this is what has been told to me. I was misdiagnosed with this. I was told I have this. Now I'm being told I can't have babies. I was given this medication to take. I've been taking this medication. My desire is to give my husband to be a baby. I said, so what I would like from you is a referral to a specialist so that I can, you know, I want to cut out the middleman and go straight to the source, basically. And so a lot of tests that I had taken with the previous doctor, I did have to repeat, which I wasn't happy with. And every time I would go to the doctor, you know, and I said, you know, my period hasn't came. First thing they did was give me a pregnancy test. Let me tell you, that is the worst thing to give a woman who desires a baby so much. I had to take pregnancy tests on top of pregnancy tests every month, every other month, every 3 months before they would give me the clean out medication. And then to just be told, you know, oh, it's negative. You know, I don't want to hear that. Just, if it's negative, just give me a prescription. If it's not, okay, tell me what we're going to do next. So after speaking with him, he did give me a referral. I went on to see my specialist, and my specialist asked me one question. He said, have I had any type of sterilization? Meaning, had I had my tubes tied? Have I had a hysterectomy? And I said no. And he said, okay, well, when you are ready, come back and see me, and we can get you pregnant if you're willing to do the work. So, being boss lady, you know, I went back to see him, right? So, but in the meantime, before we were ready to get pregnant, I was seeing my specialist, and he was saying that a woman needs to have a cycle at least every 3 months. And so if I'm not having a cycle, I need to come in, I need to take a pregnancy test before they will give me the Provera. Because if they gave me the Provera and I was pregnant, then technically they would be aborting the baby by giving me that medication. So they didn't want to be liable. So I got that. Then I understood the whole reason for the excessive pregnancy tests. But having polycystic ovarian syndrome, living with it, it has been a struggle. When I did mention about, you know, changing up appearances, it does cause excessive weight gain, as I previously stated. So, and for women who have polycystic ovarian syndrome, you gain your weight more or less in the tummy. I mean, you will see changes in your features up here, you know, or your arms or your legs, but majority of the weight gain is in your stomach, which, in this society is not a great thing, because people automatically assume, oh, you're pregnant, oh, you just had a baby, oh, what's going on. You get all kinds of questions, and yeah, it gets to be a bit much. But another change in feature is hair growth, and not always on the top of your head. My mom used to always say I was a hairy child, because she said when I was born, I think when babies are born, they have that little hair that grows all over their arms and whatever. And I do have hair on my arms and, my legs or whatever. So, of course, I shave my legs and underarm stuff like that. But you also get hair growth, I hate to say it, but like a man, on your face. Whether it's your chin, your mustache area, you get excessive hair growth there, so if you're not mindful of that, you can be walking around looking like a man. So, sometimes you have to do some womanscaping. They do have medication for that, but it's like a daily medication. It starts with a S, spiral something, I don't remember. It's a pain in the butt to have to take. So that's one thing that I just choose not to do. I just take care of my business. I'm trying to think here. What's another issue that I dealt with? So I had the excessive weight gain, excessive hair growth. Sometimes, with the hormones being imbalanced, your progesterone, women have two hormones. We have estrogen and progesterone. So your progesterone is the one that's pretty much lacking in your body, and so the testosterone kicks in, and that's why you get the excessive hair growth like a man. Now, I've never had no hair on the chest area, so I don't know about all that, but I've heard some women have had that too. So the Provera is a progesterone type pill, because progesterone is what makes you have a cycle. It also what helps sustain pregnancy. A lot of people didn't know that. So for women who've had like miscarriages and things like that, they give them progesterone pills, whether it's by mouth, orally, or to have to insert in the vagina. For me, I didn't have to take progesterone with Miss Peanut. I did have to have it checked, though. Also, with the metformin, I've had my bouts with it, going back and forth on it, being on it for so long, being off, going on it again. And so when I did meet with my specialist, when we were ready, so we got married August 2005. I went to see him December 2005, and then we started the process of, okay, what can I do to, get pregnant? And so, of course, the first thing he wanted me to do was do the big clean out. So he put me on the Provera, which I hated, but had to do it. I also had to go on fertility drugs. So I took the fertility drug Clomid. I had to do that for 3 months. Well, let me take it back. I didn't have to. I did the Clomid for 3 months, hoping to get pregnant. The Clomid did not assist in myself getting pregnant, but it did do what it was supposed to do, which was make me ovulate. Clomid is a fertility drug that will help you with ovulation. So what I had to do was do the Provera and then do the Clomid. Like once my cycle started, I want to say 3 days into the cycle, then I started the Clomid. And then what that would do is jumpstart my body to hopefully ovulate within like a 14-day cycle, and then, do the baby dance and whatever. So I took that for 3 months, no pregnancy. I went on break. So I did the Clomid January, February, March. I went on break in April, and by May I was pregnant. So the doctor, he believes that it was just a miracle, and we do too, because we weren't getting pregnant on our own. So I don't know if the Clomid was still in my body, even though they claim, once you take it and that cycle ends, the Clomid leaves your system. I don't know if it was still in my body. I don't know if it was divine intervention. All I know is 9.5 years later, I have a baby to give a testimony about. So anyway, but while I was in the process of trying to get pregnant, back to the metformin, the doctor made me go on metformin. And he wanted me to take 1,500 milligrams. I could not do it. It was ridiculous. But when I did get a confirmation of pregnancy, I had to stay on the metformin. And I stayed on the metformin until I was 3 months pregnant with Miss Peanut. And that was a way of helping to sustain the pregnancy. So instead of me doing the progesterone, they had me still taking metformin. So just imagine, getting pregnant, morning sickness, and then having met good at the same time. All I can tell you is I only gained 25 pounds with that pregnancy because I was sick the entire pregnancy, one end or the other. Yeah, and we'll leave it at that. So after the pregnancy, they were wondering, okay, is her body gonna change? Sometimes for women with polycystic, after you do have a baby, your body will just kind of be jump started into being regular. And so my body was regular. After I had Miss Peanut and, went through my 6 weeks postpartum, I was having a cycle every 30 days, and I was doing very well. Then I started having some issues. Roughly about 2014, 13, I had an abnormal pap. Had never had an abnormal pap before. They had to do some excessive testing and biopsies and things of that nature, and I had precancerous cells. So I did speak about that too in there. And so it wasn't in the lining, though. It was more or less the cervix. And I ended up having to go through a series of, I had to do a biopsy, I had to go in and have a surgery called I forgot what, cold cone something, don't remember. All I remember is they had to put me to sleep because they tried to do it in the office, and boss lady doesn't do well with pain. So I had to have the procedure done kind of like twice. But anyway, I had to have pretty much a lot of my cervix cut away. So the doctor had told me if I wanted to have another baby, which at that point we were trying. It was like 2012, between 2012 and 2014 I was having these issues. If I want to have another baby, more than likely I would have to end up on bed rest because I didn't have much cervix left. And so once I was told that, I said, you know what, I'm not going to jeopardize my life, and I know I can't go through the depression of miscarriage, so we stopped trying. So I did have some precancerous things going on, and, it all stems back to polycystic-ovarian syndrome. So going forward, the doctor tried to put me on metformin again because basically, supposedly with polycystic-ovarian syndrome and taking the metformin will help you lose the weight. Why? Because you have diarrhea all the time. For me, the metformin just sustained me. I never lost, but I never gained. I have worn the same size clothes for 20 years or more. So I am maintaining, even without taking the metformin at this point. I have been off metformin now for roughly 2 years, I want to say. And I'm maintaining myself. I get my diabetes check every year. I get my A1C check every year, sometimes twice a year. When I go in and do you need to have anything checked? Yeah, I check my A1C. I always do that because I do have the family history of diabetes. So, but like I said, with being pregnant with her, I did have to take the metformin, which, I thought was weird, but okay. And then I did try to take it within the last, I would say, 2 years, and I ended up getting sick off of it. And so I said, from here on out, unless you diagnose me completely with diabetes, I refuse to take the medication. So I have not taken metformin any longer. As far as the Provera is concerned, if I go longer than 3 months, I do, without a cycle, I do go to the doctor, and the doctor will prescribe me Provera after a confirmed negative pregnancy test. So that is the only medication that I will take. Sometimes I teeter-totter, I'll wait. I think after having the whole precancerous stuff going on, I think the longest I went without a cycle was about 51 days. And so, I definitely watch it. I have a calendar tracker on my phone, and so I can go in and kind of see, okay, When am I supposed to be ovulating? When am I supposed to be having a cycle? You know, and I go from there. And I actually use this app even when I was trying to get pregnant. So I just continue to use the app every month. It just kind of helps me keep track of things. And then I also just kind of keep track of my different feelings with my body. Like my body kind of tells me when my cycle's coming. I can always kind of tell when I'm just irritable for no reason, or if I'm just craving chocolate for no reason, because I don't eat a lot of snacks. So if I'm really really wanting some chocolate, I'm like, okay, let me look at my calendar. Yeah, it's coming. It's gotta be. You know, I also have different types of like aches and pains I feel within my body, which I don't know why, but you know, that's also intel for me to let me know that my cycle is coming. So, you know, or I get like really cold and, you know, so I'm living with it. You know, I don't let it live me. You know, I did wear it as like a badge of shame years ago. You know, like I said, I went through depression with it. It was really hard, especially because after finding out, I didn't tell a lot of people. Like my immediate family knew what was going on, but like outside people, outside friends, they did not know. And so you know, people would say the same comment that we even hear to this day. You guys need to have a baby. And it's like, you know, don't say that, you know. Or why aren't you guys having another kid? You only got the one. It's like, don't say that. And even now today, people will make comments. You guys need to try for a boy. And I'm like, guess what? I'm not Halle Berry or any of those other celebrities that are 40 plus years old having babies. And no, I'm about to be 40. I'm loving the fact that we have Miss Peanut. I enjoy being able to travel. A baby will slow us down. So, you know, I was very specific in my prayer that I wanted to have another child for my husband. I was able to bless him with that child. You know, I went through a lot of changes, you know, during the whole infertility situation. And I just kept telling the Lord, if you allow this to happen, I'm good after this. And so, like I said, we did try again, and yeah, it was something else. And so, you know, here we are waiting for this big fat positive pregnancy test, and it wasn't meant for us. And I was blessed with little man. So, you know, I have my boy, so to speak. He's just not my son. He's my grandson. But, you know, I mean, there's days where I think about it, you know, do I want to have another one? Then I think about all that I went through, you know, and going through with the polycystic stuff. I don't want to go through that again. So I'm good. You know, I keep up on what I need to do, you know, dealing with it. I did request a hysterectomy after finding out, and I did mention that in my weight vlog. I did request a hysterectomy. I'm glad the doctor said no. They said you are at an age of still childbearing, so no, we will not give you one, which I'm glad I didn't get it. So, you know, it is what it is. Now I really kind of want one. I hate to say it like that, but, you know, my cycles are crazy. But, you know, it is what it is. And, you know, if the Lord says different, then that's what will happen. So I just wanted to give you this overall view of polycystic-ovarian syndrome, as well as Boss Lady's dealings with it and living with it. And I thank you all for watching, and see you on a new video. Bye.